My name is Shayna Merlin, and I'm a professional communication skills trainer specializing in healthcare providers. In this three-part video series, I will offer you some practical tools and techniques to help de-escalate difficult patients. All healthcare professionals at one time or another find themselves confronted with a disruptive patient that can be hard to handle, argumentative, angry, or even violent. These patients are often scared, ill, or in crisis. While that does not excuse the behavior, it may explain it and help you approach your patient with objectivity, calm, and compassion. First, let's take a look at a scenario of an encounter between a physician and a patient that escalates out of control. Then, we'll discuss how such an encounter may be avoided by recognizing cues to help you identify a potentially disruptive patient and prepare for their visit.
Okay, right. Can you look in on the lady on 4? She might need some help. All right, thanks. Okay, Mr. Johnson.
It's Johansson.
Right, Mr. Johansson, what seems to be the problem?
Well, the first problem is I've been sitting in this room for the past 30 minutes freezing.
Well, I'm going to stop you right there. So far today, I've had 2 PAs call in sick, and all my patients are running late because of the construction traffic.
That's not my problem.
What did you say?
Nothing. Look, I need a scan. My back is killing me.
All right, so tell me about your back pain.
I've told the whole story to your nurse 20 minutes ago. How many times do I have to repeat myself before I can get some help?
Now, hold on there. I got 10 minutes before I need to see more patients, so sit down, start from the beginning, and tell me about your back.
Get your hand off me. I told you my back hurt. What kind of doctor are you?
What kind of doctor am I? What kind of doctor am I? A doctor with 25 years of clinical experience. Now, you can either calm down or get out.
Well, forget you, man. This place is a joke.
Being able to spot a potentially disruptive patient can help you prepare and effectively respond. No surprise, a history of violent behavior, hostility, or aggression is often the first predictor of a disruptive patient. Of course, most patients never act out, and if they do, it's only in isolated moments, in times of stress or high emotion. Let's look at the behavioral and verbal cues that can help you identify a possibly disruptive patient. Some behaviors or nonverbal cues of a possible disruptive patient may include dirty, disheveled clothing or neglected hygiene, arms held tightly across their chest, aggressive or threatening body language or actions such as clenched fists, pointing, or slamming doors, heavy or rapid breathing, pacing or rapid movements, trembling or shaking, a frightened facial expression signifying distrust or anxiety, a fixed stare, frown, clenched jaw, sneer, or reddened, flushed complexion, throwing or damaging objects such as pens or magazines, sudden changes in behavior from seeming relaxed to quickly becoming agitated, sad, or excited, and indications of drunkenness or substance abuse. Some verbal cues of a disruptive patient include a raised voice, speaking loudly or yelling, mumbling to themselves, swearing or making threats, or an aggressive or sarcastic tone of voice. All of these cues point to an escalated emotional state. If you are aware of an upcoming encounter with a patient you know to be difficult, take some extra time to prepare. Inform and prepare your staff well in advance of a possible difficult patient situation so that any additional preparations can be made. If possible, block out extra time for that patient on the schedule. If necessary or appropriate, let your colleagues know what triggers may make this patient become more difficult. Before interacting with them, take a breath and remind yourself to remain objective and try not to take things personally. Focus on the care plan as opposed to any emotions you may feel. It's not always easy, but knowing this is more about them than you might help you manage the encounter better. Know your own boundaries. Recognize that when they are crossed, it's time to stop trying to de-escalate and time to leave and call for help from staff, security, or police. A cross boundary could be when someone makes a threat, damages property, or refuses to follow instructions. Being clear with yourself and your staff will help you keep a cool head and be decisive when things get heated. A patient may become violent for a variety of reasons. Possible factors may include patients and their families being told of a poor prognosis, patients known for seeking opioids, patients experiencing intense pain, patients who may be impaired by drugs or alcohol, patients with an illness or a disease process associated with agitation or violent behavior. When you know a potentially challenging patient is on the schedule, plan to have your front desk staff escort them back to see you or to a designated waiting area as quickly and politely as possible. Consider establishing policies and procedures like this for dealing with disruptive patients or workplace violence. Include such guidelines as how to communicate with colleagues during an active emergency or patient incident, assigning roles to different staff members in case of an emergency, such as calling security or 911, evacuating the waiting room, or assisting the physician with the aggressive patient. Developing a buddy system so that no one is alone with a patient with a history of outbursts, inappropriate behavior, or aggression. Supervising the movement of a potentially disruptive patient through your office, practice, or facility. Consider modifying your workspace to better handle aggressive patients. Modify floor plans for better lines of sight and access to exits. Establish separate waiting areas to bring potentially aggressive patients away from the other patients and staff members. In our next video, we'll describe verbal and nonverbal techniques for de-escalating disruptive patients. For more information about TMLT's risk management help and services, please visit www.tmlt.org.